to the videotape series Manual Therapy, Biomechanical Assessment and Treatment Techniques. The series is intended to help the student of manual therapy practice the techniques of evaluation and treatment after leaving the classroom and the instructor. All of the techniques demonstrated are based on those taught on the courses offered by the Canadian Physiotherapy Association and the North American Institute of Orthopedic Manipulative Therapy. It is assumed that the viewer has the necessary knowledge of anatomy and biomechanics to understand the basis of these techniques, and the videos only concern themselves with the technical aspects of manual therapy and not with the underlying theory. While these tapes will be of use to any therapist learning manual therapy, maximum benefit will be obtained if they are viewed in conjunction with participation in the certification courses of the North American Institute of Orthopedic Manipulative Therapy, or the extremity vertebral courses of the Canadian Physiotherapy Association. Volumes 2, 3, and 4 contain information on the application of manual assessment and mobilization procedures for the spinal and peripheral joints. Volume 5 illustrates advanced techniques for the assessment and treatment of the TMJ, pelvic and costal joints, and the techniques of high-velocity, low-amplitude manipulation of the peripheral joints. Jim Meadows qualified as a physical therapist in England in 1972. He has received instruction in manual therapy from a number of authorities, including Dr. James Syriacs, MD, Rolf Ludwig, Cliff Fowler, and Earl Petman in England, Canada, and Norway. He passed the Canadian final examinations in manipulative therapy in 1982. He is, at the time this video is being made, a registered instructor and examiner with the Canadian Physiotherapy Association and the North American Institute of Orthopedic Manipulative Therapy. He is also chair of the Canadian Physiotherapy Association, National Education and Specialization Committees for Orthopedics. Presently, he is a graduate student at the University of Alberta and has been accepted on faculty as an assistant professor. Improvement in manual therapy is an ongoing process of which learning the basic theory and the techniques is only the first step. The theory must be constantly applied as each patient comes for treatment and the techniques practiced consistently both on the patient and in study groups. It is only with experience that the manual therapist can practice with facility and competence. The purpose of these tapes is to assist the student of manual therapy in one aspect of the process, the learning of the techniques.